Thank you for those online rejoining us for the live stream this afternoon. Those of you that did not check the changes in the agenda because of the hurricane in Florida, Susie Orman did go at 9:30. Her comments will be available on the recording when those are posted in a couple of days. But you get me. Obviously, everyone in the room knows it's going to be me. Thank you, Greg. I appreciate that. At least I feel the love from someone. So I want to get started on building more of our results from the employer survey that we did. Jake Spiegel did many findings from it. He focused in on more of those particular specific benefits that were offered that he talked about in his panel. Could you go to the next slide, please, John? And we could talk about more. I'm going to talk about more of the things around the thoughts of providing financial well-being benefits. We'll talk about companies' concern, how they're providing the benefits in general, some particular thoughts on where they're going to be focused on for the financial well-being benefits, and really kind of why we felt comfortable moving this particular part, this presentation, was we're going to talk about the motivations and measurements of financial well-being, which is going to be the focus of the panel following my presentation on the employer survey. So I will get started here on the first one, company concern and responsibility, on the next page. So what we see here is we asked the employers how concerned they were about the financial well-being of their employees on a 10-point scale. So from 0 to 10, how concerned were they? We could see that 43% of the people, of the representatives from the companies, thought that they had very high concern, that they put a 9 or a 10 for their concern. Another 40%, what we called medium concern, was 7 or 8. So that's still at the upper half of the scale of the 0 to 10. So there is a high level of concern for these employers to provide these benefits because they really want to help their financial well-being of their employees. We can kind of see that on the next slide when we talk about whether the company thinks it's their responsibility to help with their mentally healthy and emotionally well for their employees, to help them be healthy and physically well, and as well as to be financially secure and well. Companies think it's 90% of companies think it's their responsibility to do so. And it's interesting, even though these are a little bit larger companies, we compared this to our companion survey, the workplace wellness survey that we do with Greenwald Research, which is of employees. And what the percentage of employees also thinks it's their employer's responsibility to help with these issues of wellness. And we can see it ranges from almost 80% down to 2/3 that employees think it's their responsibility. Employees think it's their employer's responsibility to help them be well in these 3 different aspects of whether it's emotional, healthy, or financially securely being well. So that it's really an important aspect that if employers want to attract and retain workers, and workers are expecting that their employees will do this, that they follow through. But it's also, you do see a high level of concern in general, particularly among the sample that we look at for those larger companies that are interested in providing these benefits. On the next slide, we could see more of how this goes, of what they think about their efforts. And you can see that employers in general think they're doing either an extremely or very good job of providing their benefits. You see 70 to 71% on whether they're helping with their physical, financial, emotional, or social well-being. But what's interesting is this is something that David John pointed out this morning. There does seem to be a little bit of disconnect between how effective employers think they are and how effective employees think that their efforts are. And you can see that the employees only think that their efforts are only 30 to 40% of employees think that these efforts are either extremely or very good. So there is that one disconnect between really of how effective these benefits are being provided between what the employer thinks and what the employee thinks. And then on the next slide, we move into the next area of the state of financial well-being. And here we're going to talk about the approach to providing financial well-being initiatives. And we asked for those, and this is because we had that 3 categories of them to be at least interested in up through currently offering. And one thing that we've noticed that being able to find, employers, you could see this trend going back from 2018 to 24, you still see a clear trend away from those just being interested in. Most of the employers that are there are either actively implementing or have already currently offering. And you can see that that's something that has really been a trending toward, that more and more employers are seeing the importance of that, understanding that employees think it's their responsibility to help them be financially well, as well as healthy and emotionally well. And these benefits are a big part of that. And you do see that it's more likely that larger employers are to be currently offering these benefits than smaller employers. So on the next slide, we're going to look at the primary approach to providing this. And again, we asked them whether it's a holistic program, that there's a package of benefits working together. It's a periodic or ad hoc campaign, a one-time initiative, or a pilot program. And again, you see kind of the shift away from just being a one-time initiative somewhat into more likely being a holistic program. We really have 60% of employers that are in that situation of at least offering these benefits are planning or are doing it in a holistic manner. So you can see that that's one thing, is just really trying to incorporate and getting those benefits working together instead of just doing a program here and there that has been going on. It's still being developed, but it really kind of moved to and really important part of being a holistic program. And again, you can see that larger employers are further along on this holistic program approach to providing financial wellness benefits. And obviously those that are currently offering are those much more likely than those that are thinking about it, either implementation stage or only interested in it but haven't got to the implementation stage. Again, next we see then what we think about the budgets. And this was a question of whether they expect their budgets for providing financial well-being benefits to increase in the next 1 to 2 years. And we see that there is pretty strong confidence that they'll either increase. We see about 20% will think their budgets will increase, and another 50% think that their budget, it's 20% significantly, 53% somewhat, and 25% not change. But one question we did not ask is whether their overall benefit budget will be changed. So we don't know if this is a replacement for other types of benefits, or that this is really going to be something that's going to continue on and be a bigger part of the budget as people really understand the importance of an expectation that workers feel from providing these benefits. And the next slide then looks at engagement. We've been doing this engagement question, and you can kind of see that bar, the bars that move over. We did this by the size of the companies. But overall, it's at least 50%, roughly 50% of the employees or more are being engaged in these financial well-being benefits in employers. This has moved out. Engagement has been increasing as we've been doing this over the years. But we still see that the employers think that they are getting more engagement than they expected. They are getting 60% more engagement. While engagement's still not at the 100% range, the 50 to 75 is the most likely in each of the employer size categories, whether it's the smallest or the largest. But there still is that expectation that they're doing more, and we have seen that these benefits are more likely to be engaged in as we've been doing this survey over the years. That highest bar used to be in the 26 to 50% range. Now it's moved into the 51 to 75% of employees are engaging in the financial well-being benefits. So that is a sign that both more benefits are being provided and more people are being engaged in those type of benefits. So in the next part of the survey I was going to talk about was there's one very important slide I almost forgot. But this is the reason that employees are not engaging. This is something that Barb touched upon in her remarks with Susie Orman. And you can see that that big question is, because the orange bar is what the employees see as a barrier to not being engaged in the financial well-being benefits. And as she pointed out, not wanting to disclose the financial information to employers is the second most prevalent at 23%, which is just slightly below the offerings and do not address the employee's needs at 24%. But you see that that's different than what the two highest barriers employers think that employees are engaging, and that's the lack of understanding of how the benefits work, or the benefits not customized or personalized enough. And it's kind of interesting how that question is phrased. Benefits are not customized or personalized enough. I think this is more kind of like what David was talking about, using that type of language, customized, personalized. What does that mean to a lay individual, as opposed to you look down, we say that offerings do not address the employee's needs. So does the benefit need to be exactly tailored for the employee, or does the benefit need to exist in general that meets the employee's need? And that seems like kind of the difference, that it's not necessarily perfectly customized that the benefit is. It's not Bob Snake's pet insurance. It's that the pet insurance is being provided. So it's that type of finding what benefits that employee workforce needs, as opposed to maybe making it as fine as possible to that employee. So that is a really kind of interesting thing of the difference in the barriers. But it is interesting that it's still pretty high for both people to think that they don't want to disclose financial information. That is something that came out as a theme in the earlier panel, is that there is that hesitancy to provide that information. And that's why, such as like a financial therapist or whatever, that's something that's removed away from the employer, that there's that kind of firewall or whatever you want to call it, that keeps that information away from the employee, from the employer, to make the employee more comfortable to engage in these type of benefits. So now I move to the next topic of where we're talking about financial well-being benefits. This is really going to focus on the number of benefits and the top priorities. So we asked about 16 different specific financial well-being benefits that could be possibly offered. You could see that there is a none. The none is because we asked them if they provide a financial well-being program, but they may be providing something that we didn't ask about those 16 particular ones. So it's just about the 16 ones that were listed. Those that Jake talked about earlier are the ones that we were talking about. And we could see that there's about 5.6 of those 16 benefits are being offered on average overall. And we can see that it increases with the size of the employer. The small employers are at, the small defined this way, is 500 to 2499 at 5, and it's about 6.8 for 10,000 or more employees. It's interesting that the concern is not directly linearly increased, but it is much higher. It's at 6.5 of these benefits are offered for those that were in that high concern for their employees' financial well-being, compared to either just above or just below 5 for those that have lower concern for their financial well-being of their employees. And next, we want to talk about then the top priorities of offering. And you can see again, is what we talk about, is that it's really the personalized financial counseling or coaching or planning is the top priority of offerings. Again, we've moved away from helping just on focusing on retirement preparedness and looking at the total financial picture, because you see the next one is financial planning, education, seminar, or webinars are the top priority. Something that is really helping individuals with their total finances. Those really stick out compared to some of the other priorities on here that could be anything from student loan debt assistance to tuition reimbursement, emergency savings accounts, but really helping those individuals. In many cases, the personalized coaching and financial planning, the other more specific benefits can be an element of that. So the top priority is helping individuals with all their needs, but a student loan debt reduction or emergency savings account can play into that particular overall top priority. So it's important to have those additional benefits, or to think about how your workforce can use these particular benefits to make all those things work together, because you need all these potential things to really help the employees move on and provide increasing their financial well-being and security. So on the next slide, this is the motivations, measurement, and financial wellness initiatives. We had a number of questions on this survey. Jake actually talked about the top issues and areas of focus. I am going to be looking at more of the motivations and the measuring of success, which will lead us right into the next panel, which is going to really focus on specific examples of that. So first of all, we asked about the steps that have been undertaken to understand employees' financial wellness needs. And the number one step that people have taken is surveying employees or using data that's already available that they can compare. Then they analyze other quantitative data. The least likely thing to have done is to implement some national standard or some government standard, something that's away from what they away from what their direct workforce is. They focused in on surveying employees, really understanding what their workforce is. And that's particularly key thing is to really, because really what we found is every workforce is different. So one financial well-being standard for one set of workforce isn't necessarily going to carry over to a different type of workforce. Particularly, we talked about being a workforce that's on desk all day versus those that aren't on desk all day. You're going to get two different results on what the benefits are needed within those type of workforces. It's also interesting who is conducting this research, and many of the company is doing it themselves, but they also generally have help from either a benefits provider, an outside consultant, or some other third-party vendor. That it's about half and half when you add these up all together, the employer doing it itself, or they're getting help. And many of them are doing it in tandem with these companies, with these different types of companies. So on the next slide, then we look at the top factors in measuring success. So we're getting really into what we're looking at here on the next panel. And we could see that the top one is worker satisfaction. And you can see the third one is worker satisfaction with the financial well-being benefits. And in between is productivity. So again, we want the workers to be satisfied, but the employers also want to get something out of it through increased productivity. So it's really two things that are going on to really find out what we're looking at. Productivity has kind of moved up over the years, but satisfaction and retention is something that has been a big part of that. And certainly with a hotter job market, this has become very important, but they still are looking to measure and want to measure that productivity increase so that they get some ROI on their benefit provision. So now we asked what particular data this track to evaluate the effectiveness of their offerings. And first, not surprising, satisfaction is at the top. So they're tracking satisfaction data to find out what they do. They also surveying employees and they're measuring engagement. But really, as you can see, most of those first three are really looking at satisfaction and engagement with the benefits. You don't get to productivity really till the fourth, most likely. And again, statistically, that's really no difference, but it is fractionally less than really the three different types of ways that satisfaction are being measured at the top three. And then productivity is then listed at the fourth. And again, conducting financial wellness needs assessments is another one. So you're really getting into both productivity and you're making sure that there is some increase in their financial well-being by using those two. But still, satisfaction seems to be coming out at the top. And it looks like we're going to be moving more as people can really develop the measures for productivity in a more widespread basis, because that has been a challenge in many cases to develop those metrics to be able to do that. A couple more slides here. We looked at whether they've developed a cost-benefit analysis of the financial well-being offers, and 70% of employers said that they have. What did they consider in that cost-benefit analysis? And as you can see, if they've improved their employee financial well-being, or if they've improved productivity and performance. And then actually third comes in employee recruitment and retention. So it seems a little contradictory that recruitment and retention is not at the highest in that cost-benefit analysis when that's what they're most likely to be measuring. But when that cost-benefit analysis really focuses in, they are looking at those other issues of what data they're tracking just below satisfaction in productivity and financial wellness needs assessments. And one more slide on this. What are the top challenges? What is preventing employers from offering these plans or making these widespread? And it, first of all, is the cost to employee and cost to employer is their toughest challenge in providing that. Again, while they think their budgets are going to be expanding, cost is still a paramount challenge to expand these benefits. Even though they see the need in general, it's still hard to really find that because we aren't getting to that point where we have great measurements of those productivity measures where the employers can see that money is coming back to them. They're getting there, and we're going to talk about some of those in a second, but there still is that disconnect of really getting that totally in such a picture. And again, complexity of benefits, data privacy, and access to service and initiatives are all things that are challenging in employers. So cost and the things that we talked about, the barriers from the employees engaging, are right there with the challenges of offering financial well-being benefits. Because if they want to offer a benefit, they want to make sure that the employees are engaged in it, because it's all part of the satisfaction and retention of workers and making sure that they're getting ROI. So I'm going to stop there. This is just, even though Jake and I have presented a considerable amount of the survey, there still is so much more in the survey. We're going to have a report coming out later in October, early November, that you'll get even more results from this survey and more perspective on these surveys. So now I want to introduce Sarah Viapod, who is going to be moderating our next panel on measuring success of financial well-being strategies. So I will ask that panel to come up and take over. Thank you.
Well, thanks, Craig. And I hope everyone had a great lunch, and we're going to have a good discussion around the measuring of the success of financial well-being strategies. We have a great panel up here today. First off, I'm Sarah Viapod, and in my role as a research consultant at Mercer, I've had an opportunity to talk to multiple employers, multiple vendors in the financial well-being space. What we've learned is that financial well-being can really mean different things to different people. It means one thing to employers, another thing to employees, and then we have all of these different players in the mix. During our discussion today, we're going to really dig into the reasons why employers are adding financial well-being benefits, how they determine what their employees need, and what they're doing to measure the impact of these programs. So with me today, I'm going to go in alphabetical order. So we're going to start down the end with Don Baylor, Head of Worker Solutions and Services at Lafayette Square. So Don, I'm going to ask you to introduce yourself, and I'm going to do this with each of the three panelists. I also want to ask you, what is one financial habit or strategy that has had a positive impact on your own personal financial well-being journey?
Sure. Thank you very much, Sarah, and thank you to the EBRI team in general for inviting us here. My background comes from, it is advancing financial well-being for low and moderate income folks. So I've been doing this for 25 years at the public policy level, the advocacy level, at the research level, as well as philanthropy. My most recent stop before Lafayette Square, I was a senior program officer at the N.E. Casey Foundation, head of their family financial stability portfolio. And so we really honed in on household debt as preventing, reducing household debt as a major strategy to move families ahead. I would say my main financial strategy is just auto saving on almost a daily basis, quite honestly.
So next, we're going to move on to Megan Conroy, the Director of Financial Education Strategy and Delivery at Bank of America.
Hi, good afternoon, everybody. I want to give a shout out to all the panels that have come before us, because I think you made it really easy for our panel, because there's been a lot of great conversations. I am responsible, and my team is responsible for creating our financial engagement programs, as well as I manage the team of folks that go out and deliver those programs. So it's a really interesting perspective to hear from the plan sponsors that we support, what they're looking to do from their employees, and what we hear directly from their employees. And you've seen it in some of the results that have been put up today, that oftentimes they're not aligned. So it's a really interesting position to be in. If I, at the risk of maybe aging myself, my mother was the manager of a bank branch growing up. And she was a big believer in the automatic savings. So, whether it was the passbook that you had stamped, when you put part of your allowance in it, or the old Christmas clubs. So saving the goals. And, my first job was at the bank that my mother worked at. And that became contributing to my 401k, and that sort of concept of, if it's not coming to you in your direct pay, whatever you can defer, if you don't see it, you don't miss it, so put it away directly from your pay.
All right, and last we have Barbara Kanji, the Director of Retirement and Smart Saving at the American Express Company.
Thank you. Thank you. I'm so happy to be here, and I agree with what Megan said about all the panels that came before us. A lot of it is a lot you'll probably hear us say as well. So I am the Director of Retirement. So I'm retirement strategy design. I oversee the investments and the governance committees that manage those investments for our retirement program. I'm also responsible for Smart Saving. That's our financial well-being program. We created our program back in 2009, 2010. When I came to American Express, they put me in charge of retirement education. That's actually why I took the job. And so when I was sitting in the back of the room and I would hear questions, because I'm like, why aren't people in the plan? This was when you had to opt in. Why aren't people joining the plan? Like, this is, the match and all. And what I heard wasn't that they didn't want to do it, it's that they didn't think they could afford to do it. And I had such a huge aha moment. I went back to the office. I said, and I'm in HR. And I said, I don't know if this is ours or should I be talking to somebody in finance? People need help with money. This is about cash management, so like, how do we help people? And so from there, our financial well-being program was born. So we call it Smart Saving. We have a physical well-being program called Healthy Living. We have an emotional mental health program called Healthy Minds, and the financial one is Smart Saving. And we take this holistic approach to how do we think about our programs? How do we help our colleagues? And we call our employees colleagues, so you're going to see me switch back and forth with the language, but how do we help our colleagues find a way to put money aside so that they can build that future paycheck? As I remind people, you're paying yourself in the future, negotiate your salary today. How much do you want to make then? Start paying, putting the money aside so you can. And I think, and Don, again, automatic saving was going to be my comment. And for the reason I'll tell you why was I was going along and I would intend to, just like everybody intends to do something, right? I would intend to, fund my IRA. Of course, I'd wait until the last minute, but the money is, you know what? I have to automate this, right? And then the other thing is automatically escalating my savings. So like, maybe I can only afford to do this much today, but and if I do it automatically, I don't even realize that it's gone up. And that's what I love about automatic escalation in the 401k plan.
Thank you. So as we've discussed on previous panels, financial well-being is a very personal journey, and it's going to look different for every employee. And we've also seen it doesn't necessarily depend on your level of income. There are so many different factors that come into it. What are the key factors that you consider when you're evaluating the need for a new financial well-being benefit or a new strategy, either for your clients or in your own organization? So I'm going to start with Barbara.
So this is a huge challenge. So one of the things about when you're a plan sponsor, when you're an employer, is what kind of programs you put in place. And when you put them in place, a lot of times they're there to stay. So sometimes it's hard to take them away. So you really have to be sure about what you're going to put in place and how you're going to do that, and what's the cost, and how do you make the pitch to somebody if you need money. So when we were looking at, when we did take that look at financial well-being, we looked at everything we had. And we had a couple of surprises when we looked. So we just looked at our benefits, just what we had. And a couple of things that we found one of the biggest surprises was our life insurance provider also provided an estate planning program at no additional cost. So anybody that had supplemental life insurance or more than the basic that the company was providing, they could have access to wills, power of attorney, and living wills at no additional cost. So they could get that done. So we started promoting that. What we did was we repackaged everything, right? So we repackaged. And so now we have, everything that we had, and now we were marketing it. As I've been thinking about, what comes next, there's been a lot of evolution in this space now in the past few years. So and I'll talk about, we do have a financial coaching service, and how can we supplement that? It works for some people, it doesn't work for others. They just want digital, just, let me do it on my phone, I'm good. Others, how do we think about what can we add? So you have to be thoughtful about how you're adding it and what you're adding. One of the things we ended up adding, and again, not necessarily in financial well-being, you know, that niche space, but just thinking about long-term disability, we went from offering it as a voluntary benefit, you had to opt in to elect it. What we found was people that really needed it weren't opting in, either for financial reasons or whatever, they don't realize. And I think somebody said it earlier, disability is more likely than death while you're working. So we instituted fully company paid long-term disability. So it was, you know, it's a different way of financially protecting our colleagues.
So to you, Megan, from the provider perspective, like what factors do you take into consideration when developing solutions for the clients that you work with?
So, you know, we encourage a few things, and I would expand a little bit on what Barbara said in really understanding the usage of the plans that you have today and what that information can tell you. And I would say working with your provider to do that is probably where I would start. So for example, in your 401k or any other enrollment-based program, what is your enrollment rate? How does that compare to the national average? How many loans are being taken from your plan? What amounts are they? Does that indicate to you that folks are having trouble with emergency savings? So really understanding the nuances of just the plans that you have today and what that information is telling you is critical. I heard someone mention, I can't remember which panel, but I heard someone mention healthcare costs in retirement, and it's something that we're really passionate about. The lack of information and understanding on HSAs is really astounding. And we've seen, our research would tell you that there's been a 7% decrease in the number of people that can correctly identify what an HSA does. And the increased lack of understanding of using it to invest for those future payments and not just using it as you go is critical. So I always start with understanding the plans that you offer today, how they're being utilized, and what that information tells you about what you might need to focus in on.
All right.
So yeah, just to level set for a second. So Lafayette Square as an investor, our main vehicles are private credit funds. So we are largely focused on providing capital to the lower middle market, right? So we're looking at, you know, companies that are below $30 million in annualized adjusted revenue or EBITDA. Typically, these companies are 1,000 employees and below. And as this type of investor, we are required by federal law to provide managerial assistance to our portfolio companies. From the very beginning, Lafayette Square was very intentional that the managerial assistance would be centered on low and moderate income workers and would be focused on employee benefits and those services that really help to drive recruitment and retention. As a result of being in this ecosystem and in this space, we actually, you know, work very closely with our portfolio companies who are in many ways operating, I would characterize them as a legacy portfolio of benefits, right?
Mm-hmm.
We're talking about traditional employer-based healthcare with traditional ways of employees paying for that care, no matter, or those premiums, no matter what their income is, no auto enrollment in their 401k, very low retirement participation. We're talking in the teens, right? So no auto enrollment, no auto escalation, as well as no real financial well-being benefits to speak of. And so when we enter and we have conversations with these incoming portfolio companies, we actually do an assessment of their workforce. And we do an assessment of their benefits as well. And after probably 50 to 60 times of doing this, because right now we have about 30 portfolio companies, but we also have a lot of companies that come through our pipeline that we actually don't end up closing a deal with. But nevertheless, we actually do get their wage data, their benefits data, really kind of a full employee census. And so what we see over and over again is this huge gap between low and moderate income workers who are enrolled in retirement at about a 10% clip versus those employees that are non-LMI that may be enrolled at a 60% clip. And so a lot of things go into how we look at what type of benefits would be good for this workforce. Believe it or not, gender is a leading consideration, believe it or not, in whether or not you're going to think about financial coaching or something that's more automatic. The research shows us over and over again that women engage with these benefits at a much higher rate than do men. Age is a factor as well. Geographic location is also a factor, as well as how HR communicates with those employees. We have a lot of companies in our workforce that are predominantly LMI, but that are deskless, in which communication about benefits from HR Central to those workers is virtually non-existent, right? And so figuring out that puzzle is a big factor to decide which benefits that we actually want to pull out of our bag. And to that point, so far we've secured agreements with about 19 third-party providers. So we act a little bit like a benefits broker or benefits consultant shadow, but we don't obviously get paid by our third parties for those referrals. But about 10 of those are financial well-being initiatives ranging from credit building to home ownership.
So Megan, we talked briefly about the role of employee or ERGs, employee
Resource
groups.
groups, yeah.
resource.
Yeah.
So can you touch on how you've been working with ERGs to promote financial well-being benefits?
Yeah. So, again, I think it speaks to a lot of what we've been talking about earlier. Asia, I think you said you work with a lot of women, you work with a lot of Black women, right? That makes sense. People want to hear from people that look like them, right? So what we find is that when employers work with employee resource groups to create and deliver these programs, they have better, what I would call action rates associated with them. So while you might not be casting as wide a net with what you're doing, you're getting a much better engagement rate in what you're doing. So when employee resource groups come to the table, they typically have a very specific goal in mind. And some of the things that we've talked about and the barriers and the challenges where I might be uncomfortable talking to you about how much I make, or I might be uncomfortable talking to you and letting you know that, I'm having some credit card debt challenges. Having those relationships through those employee resource groups by nature makes people more comfortable, and you're seeing better engagement with those programs. I think a great example for us, something that we offer as part of our program outside of even working with clients is, about 2 years ago, we started hosting periodic women's panel sessions, and what better way to do that, right? Women listening to other women talk about the challenges that they face, where they are in their journeys, and how they've, solutioned around them. And, as my young daughter would say, it just hits different, right? Women listening to other women, it just hits different. So I also take it into account when I look at the education specialists that work on my team that really are the boots on the ground, going out and delivering that education and partnering with our sponsors and these resource groups to ensure that we have a diverse workforce, whether that be women or Spanish speakers or, other people of color.
Great. So Barbara, are there other ways that you've been using or speaking to your employees to determine what financial well-being benefits are needed, would be used, would be appreciated by your employees?
Sure. So definitely during some of our employee surveys, we're asking the question, we also ask the question about, do you have money saved, like that $400 number. So we do ask those kinds of questions as well. But when we do talk to colleagues, as well as, you read any national survey, pretty much the first item people want is they want to have, financial planning access, they want to talk to a financial planner. So we do provide, we've provided it since before I came to American Express, and I've been there 17 years. We provide, we used to call them financial planners. Now we call them financial coaches. It's a little bit less intimidating because people will say, I don't make that much money. I don't need a financial planner. I just need to figure out how to pay my bills, right? And so we call them financial coaches. We do provide them. We put in our communication materials, that you have a financial coach available, and really try to push that. And everything's about relevance. When is it important to me? Like, do I have some life situations coming up, or is there some, like now I hear from people when they're turning 50, because all of a sudden retirement's a real thing. And so how do I, how do they then engage with coaches? And we've tried to, put it out there. And I'll just talk about participation rates, because trying to measure, right? Measuring is very hard. So on the 401k side, I can tell you, we're doing great. We have automatic enrollment, we're doing all these right things. We also pulled back, some of the layers of the onion and found out there were ways we could tweak our design that make it even a little bit better. So again, you really have to look at the data, see what it tells you, listen to your colleagues. And what they've been telling us is they do want this engagement with the coaches. So when I look at straight numbers, so again, we're basing this on 26,000 US employees, participation rates always been hovering right around 5%, unless we're doing activities that require them to, have a conversation with a coach or take the financial wellness assessment. And we do that, we link with our healthy living, our physical well-being. So when we're doing that assessment, we're saying in order to get money put in your HSA or your FSA, depending on what, most people have HSAs, to get money put in that account, you have to do one or two activities. And one of the activities is talking to a financial coach or taking the financial wellness assessment. And so when we do that, we get a little bit of a spike. When I look at that 26,000 people, population, we know a lot of people, might have their own financial advisors already. Some of the people that, maybe at the lower pay, they've not really thought about it because, again, they think they don't make enough to have a financial coach. And we want to tell people that it's okay. So when we explain these things to our colleagues, either through webinars or the employee resource groups, we engage with all of the networks. They come to us. Now, it's interesting. We used to go to them and kind of market, hey, we have this program and we can bring it, and we do webinars. And now they're coming to us because they're hearing from their members that they want to know more about finances and make it relevant to me. And we just did one recently. So we started out with the Black Engagement Network, and then they brought in the Asian Network. And then they brought in Pride, and so at the end of the day, we had 4 different networks, which is kind of interesting when you're trying to, there's a lot of basic concepts that apply to everybody, and then there's concepts that don't apply to everybody. So you want to make sure that you're talking to people and what they're interested in, not this, because when it's general, sometimes it doesn't stick. It's got to be specific to what's important to me. But what they do bring when you go through networks, or we've had business units ask us the same thing, employee surveys are reporting back, do you feel supported by the company? And we really are really big on this, is that we do want to support our colleagues, and we provide so many different benefits. And sometimes airspace is a challenge, like everybody wants to communicate, oh, we've got this benefit, we've got that benefit. I have, we've tried to really get that message out and time it for when it's important to them. We get to do supporting our colleagues from those conversations. You get interested colleagues coming to the meetings. If we just put up, we're having webinars, and we did this little experiment. We were doing a retirement investing webinar. And I said, you know what? Let's put women in the title, and let's put in a couple of slides about women, because women, sometimes they take time off from the workforce. I did. So now I was playing catch up, right? So let's talk about things that are important to women. The first webinar, we got our usual, maybe if we had 25 people, I was doing the happy dance. When we did the one with the women in the title, we broke the webinar just by putting women in the title. It was really fascinating to see what happens, but because they are looking to talk to people like them and to hear the stories of what have you already lived through. So there's lots of different ways to, again, hear from colleagues and then make sure that we're giving them what they're asking for.
Right, and that ties back to the conversation that we had earlier about having relatable resources, and also, really trying to find people that you would trust, so employees do trust their employers more than they trust the general media, the government, and regular business. So we see that is a very big place for employees to go. So on that, so Megan, as part of Bank of America's workplace benefits, you're offering to companies of all sizes and across all industries. You work with employers on their strategies to pursue that financial well-being of their employees. What are some components that you've seen be, particularly successful in that area?
Yeah. So Barbara, I think you started to touch on it. One of the foundational programs that I think every good program needs to have is an assessment tool for folks to really understand where they stand within their own finances. And if that tool has personalized actions that come with it, even better, right? And those actions then hopefully are guiding the employees to the next best step. Something else I would talk about would be multi-channel delivery. I heard you mention varying workforces, deskless, desk workers. Maybe I want to listen to an audio cast. Maybe I'm out on the road driving a truck and I'm not in front of a computer all day. So really having a multi-channel delivery for your program, I think is important as well. And that you're really reaching people where they are and how they want to engage. When you said 25 folks attended a webinar, I would have done a dance of joy as well a couple years ago. But I tell you, post-pandemic, we have seen a real increase in the number of people willing to engage virtually. So I sort of joke at work that it's made my job a little bit easier because so many more people are willing to do that than ever. But again, that multi-channel delivery, I think, is really important. And Sarah, I think you might have said, at the end, how do you know? It's tough, right? Because as we brought up at the beginning, it's a personal journey so how do I know what makes me financially successful, make you financially successful? So how can I evaluate that program? And, I anchor back to actions. You've heard me say it a couple times now, and, in answering various questions. So am I talking to somebody about enrollment? Are they enrolling? Am I talking to, somebody about emergency savings? Am I seeing decreases in loans? And really making sure that when you are delivering education and when you are putting a program together, that you have real tangible goals for it. And I think everybody's mentioned it. I would also say survey, right? Hearing directly from people what they think works, what you see works is important.
Okay. All right, so Don, is there anything that you would add to that? Any other different techniques or tactics that you've seen put in place to encourage?
Yeah, I think I just want to bring this alive, I think, for some folks. So one company in particular, I think, is worth focusing on. This particular company, we provided capital to almost 2 years ago. And this particular company is headquartered in Alabama, Opelika, Alabama, for those of you who know where that is. But what the company does, they provide explosive screening using canines at airport cargo facilities and other facilities around the country. So you want to talk about a dispersed workforce. They're reporting to a central location every day, but that could be Atlanta, Hartsfield, Jackson, or it could be SeaTac or whatever. Very limited interaction between folks that are doing the same types of work, but in different locations, and very little interaction with their immediate supervisor. It's them, their dog, and the facility that they're going to every day, right? And so when we first interacted with this company, we started to gather their data. They had a 3-year vesting period for the 401k. We incentivize them to change that. So one of the things I did not mention is that our fund actually provides, to the earlier conversation around cost, right? So cost was a top barrier for companies to provide financial well-being benefits. We obviously recognize that quite a bit at Worker Solutions. And so one of the things that we have done, we actually put in an interest rate step down. So we will actually take your interest rate down by 5 basis points or 10 basis points if you adopt a financial well-being solution. So this particular company not only changed their retirement eligibility, they also, at our urging, adopted a credit building solution for renters, right? So rent building, credit building through rent payments. Recently, they adopted an emergency savings plan program at their office. And this was really this month, like we're talking essentially Labor Day, right? In these 2 or 3 weeks, more people have signed up for the emergency savings account than have actually signed up for the 401k, particularly those folks that are actually what we call dog handlers, which is really the core position at this particular company. The other thing that that's on deck is that in order to actually obtain this job, they actually have to go through a training program, because you can imagine you have to know how to screen for, you have to know how to deal with a German Shepherd, canine who is extremely extremely intelligent. And that training program costs over $20,000. So many of their workers, about 37% of their workers, actually have an ongoing student loan payment, right? So you can imagine not enrolled in retirement, not getting the match, but repaying student loans. And so that is kind of next on deck, is kind of scaffolding on these financial well-being solutions with the goal, hopefully, of increasing retirement participation, because we are seeing, like as we said, more people take advantage of the emergency savings than are actually taking advantage of the 401k.
So that leads us a little bit to the trends that we're seeing in financial well-being. So you've mentioned emergency savings. We talked a lot about that here today. Student loan. Barbara, are there trends that you're seeing or you're hearing from your employees that, something that is not as traditional, and, tying back to the question that was asked earlier about reactionary benefits? Like, are there programs in place to help employees, or are there programs coming to market that are going to help more employees through this inflationary environment, through the economic hardships, and what is it that employers are providing in that space?
So I guess part of that does come back to the financial coaches, the financial education. How do we provide that education? Because again, sometimes people don't have the time to sit and watch a long webinar. We've been creating some different videos. Should tap into Susie Orman's videos because she's already done them, but we're creating some that are specific to us and again, particularly with the retirement program, but also on the general financial, how do I manage my money? How do I create a budget? And we've even moved away from the budget word, and we call it spending and saving plan, because we want to tell people, look, work hard for your money. It's okay to spend some money. We're not telling you don't spend it, because as soon as you do that, then they're going to run out and go spend money. But also save some, and we do talk a lot about the emergency savings. Now, we've not set up a specific program that's been mentioned, but we've been talking about emergency savings. Goes back to when this group used to be called ASEC. We always talked about emergency savings, save 1% more this year, right? So save that 1%, put it aside. So we've been trying to build that out. One of the things that my company does, and I'm really pleased with it, there's a lot of programs that I'm not tapping into, but we have great fertility benefits. We have great adoption and birth benefits. We give long parental leaves and like all these things. So when you're thinking about like that younger demographic, and as they're thinking about how they are going to, pay for the things that they're trying to do, having children, buying a house, we do have some banking at work programs that also, provide mortgage discounts and things like that. And just education about all of that. everybody wants the American dream, or maybe not everybody does. But, if you think about, not everybody can afford that American dream of buying a home and paying a mortgage, and now all of those bills are on you. So we really try to help people figure out their finances and work out a plan that's working for them, because what works for me may not work for Megan, or may not work for Don, right? So we have to have our own plan, and that's where that one-on-one really comes really important.
So pulling in that idea of communications with employees, like we all know that that's a critical component to the success of financial well-being benefits. And I think along with that comes that personalization. So it's not just communications, but it's, okay, what is it that I need? How can I, or what benefits should I access that are going to, impact me? The survey showed, Craig or Jake, I'm not sure which, can't remember which one, talked about how one of the reasons, or one of the barriers for the financial well-being programs was the benefits aren't what I need. Employees are saying they're not addressing what I need, but they might not know what they need. So how can we help tailor that communication so that employees are seeing the benefits there that really can benefit them? Give them the why as to, why should I take a look at this benefit? How could this apply to me? So Megan, do you think you could, address that a little bit?
Yeah. And it's funny because I think Sue's mentioned it. I'm not sure I agree or disagree with what she said, but I think being able to talk about things in terms of age, I think being able to talk about things in where you are in your journey, and just in a way that's going to resonate. And, I go back to employee resource groups again. So whatever of those ways resonates with you, I think it's important to acknowledge that, when we're talking about student loans, maybe I'm not just talking to people in their 20s, right? Maybe there's parents and grandparents that are taking on debt to help their kids pay for their education, right? So really getting into this needs-based education as a model, I think, is something that's really important. And that's why I'm so passionate personally about, working with ERGs and really looking at the research and the different challenges that folks are facing. Something Bank of America is really proud to be a sponsor of is a lot of research with regard to caregiving and the financial challenges that brings. And, that bleeds into challenges that face women, because more women are caregivers than men. And really being able to speak to people on those topics in those terms. And, we went through a really simple exercise on my team. I think I mentioned that we're responsible for the program. So we create a lot of the seminars and a lot of the content that people engage with. And over the past 18 months, we went through this really interesting exercise of renaming our seminars. And, the content doesn't change a lot because the basic precepts of financial health are the same, right? Mm-hmm. Having a budget, not spending more than you make, the concepts don't change, but changing how you talk about them changes the engagement. And I think when you put women in the title, right? So I am fortunate to have quite a diverse group of folks that work for me, some young, some old, some, whatever. And changing the titles of our seminars and how we message out about them drove more engagement to some of our education sessions than we had seen for those topics in the past. So being able to speak to people where they are, how they are on their journey, and in ways that resonate with them. So it all goes back to that multifaceted approach.
So I do want to move on to talk about outcomes and the importance of outcomes. Measurement, we know, can be very difficult. There is a lot of data that is out there, both from employers, from providers. We've got healthcare incidents, we've got retirement plan data. How are we able to pull all of this together, and what kind of evolution expect to see going into the future? Like, I feel like we're in the early stages of that data gathering and data analysis. How can that help drive the outcomes? I'll throw that out there to anyone who'd like to.
Barbara, you want to start?
Sure, I'll start. So it's challenging, I will tell you that. So like I said, you know, in the beginning, when we started looking at what data do we have, we look at, you know, go with the easy one. So the 401k participation prior to, we put in automatic enrollment in 2017. Prior to that, we had an 80% participation rate. Now we hover somewhere around 94%. Opt-out rate, low, good. We looked at account balances. We, like I said, we made a tweak after, you know, like on average is a dangerous thing sometimes. On average, look good. Then we looked down and we looked deeper. We looked at, you know, slicing and dicing the data, lower paid colleagues. We looked at age. We looked at, you know, all different, you know, demographics all around the country. And, you know, so we found, you know, some account balances were lower. So we increased a discretionary contribution that we provide to the lower paid colleagues because we wanted to really boost up their accounts. And while they want to save more, they can't afford to. So we help with you getting this, whether you contribute or not. Then we do look at the participation with our financial planning service, as well as, you know, like, what are they talking about? What are those topics that helps drive? And again, we've seen some increases, you know, and it comes and it goes, but you have to be ever vigilant to keep people engaged. We have found that once people get engaged, a lot of the testimonials that we hear from people, once they get engaged, they have that conversation with the person. Oh, I didn't know what to talk about, or I thought they were going to judge me and they didn't. And, you know, so glad that this information is confidential, because we always tell people, look, they're not coming back and telling us what you talked about. We're getting, you know, aggregated, you know, trends and topics. We're not getting your personal information. That's between you and them. And just really letting them feel that. We're looking at some other ways to try to tie our data together. We had looked at some other data in the past, linkages to, you know, health and wealth. And it was trending towards what we thought and what you would all think, that they do kind of go together. We do provide, you know, resources from, you know, like our EAP provider can transfer people over to the coaches, and we're watching like that kind of data that, you know, again, trying to get the help to the people where they need it.
Yeah, I wouldn't necessarily, sorry.
Okay.
Yeah. I wouldn't necessarily call it new. I would call it evolving, is, you know, that adoption of the programs that you're speaking of. And when we think about financial wellness in that way, people don't want to talk to you about just one thing. So yes, we're a retirement provider, but don't just talk to me about retirement. I need you to understand my whole financial life. So, you know, it talks a little bit, you know, I would say that leans into a little bit of goals-based planning, but, you know, I see a continued evolution toward that. Help me understand in the context of my life. I want to go on the trip to Europe. I saw a lot of Italy on my Facebook. I'm aging myself by saying Facebook. I should say Instagram, right? So I saw a lot of you know, pictures on the Italian fronts or what have you, but understanding that I might have multiple goals, some competing goals, and, you know, still being able to message retirement. So again, people want tools and resources that are personalized to them. Know me, know my financial picture, talk to me in the context of my broad financial life.
Yeah. So I think there are a couple of different ways to think about this, and I love we're going down to the individual level. So I think for us in this room, who I think are a part of the employee benefits field, financial well-being field, as it were, there are likely a set of common measures that we can ascribe in terms of common outcome measures for particular solutions. So you can think about, take emergency savings, right? It may have an impact on X, Y, and Z. So when we introduce or recommend a solution, you know, it's always about what's the problem that you're trying to solve, right? Are you seeing an uptick in 401k loans? Are you seeing chronic low participation? Are you seeing employees approach you for cash advances, right? And so all of these things are kind of in the mix, but there's probably a priority list for HR, for companies. And so we really kind of lean in on those measures and really attempt to design the program to really address their priorities. And this is going to go down, obviously, to the individual level as well. An emergency savings account for some folks is important because it helps them go on that Italian vacation. But for some folks, it gives them peace of mind that they can handle an unexpected, expected emergency expense, right? And so there is going to, I think, going to be some customization, some variance, but I think it is under the umbrella of some common measures that we can roll up, certainly as a field overall.
So thinking about strategy then, you know, how can employers tie their financial well-being programs to their business objectives? Like, do you have any guidance around how that could work? Barbara, I'll throw that one to you.
So again, we're a financial services company. So we want to make sure that our members and our customers are doing, we're supporting their needs as well. And again, we want everybody to be in a good financial position. And so for our employees as well, you know, they know that this is our focus as a company and that, you know, we're trying to support them in their drive to be financially successful. And it's that security piece. It's not that they have millions and millions of dollars even. It's that they have enough money to pay for their needs as well as, you know, to have that extra to take that trip to Italy. And so that they can do all of that and that we're providing again, we're providing the tools and resources to help them figure that out. And then the other thing that I would say, it's about connecting the tools and resources to our colleagues, because we can have a whole suite of benefits available, but if they are not aware that they're available, or like how, you know, like, oh, I didn't know we had that service, or I didn't know that I could do this. And so just trying to educate around that. We created, just like we do for, you know, in our business, you know, good website, and you can go and access information. We have all of our benefits in one place, and it's a benefit site that people can access, not just from their work computers. Because what we also found is the financial decision maker may not be our employee, it may be the person at home.
Mm-hmm.
And so we want to make sure that they're getting the same information. Oh, honey, I didn't know you could get extra life insurance, or, oh, you know, you should be taking advantage of this, or you're not maximizing the match in the 401k plan, you know, go take care of this, because they're the financial decision makers. So we want to make sure that, you know, again, you know, financial well-being is really about making sure you're taking care of yourself with control, with confidence in that you can do it, and not to be intimidated by it.
And Megan, during one of our prep sessions, you talked a little bit about balancing money and mind, that offering at Bank of America. Could you expand on that a little bit? Like,
Yeah.
just describe what that program is. And
Yeah, I'd love to. And I think the panel that was hosted right before lunch was really a great entree to that. So we are proud to have launched a seminar called Balancing Money and Mind. And again, it's taking those basic financial concepts that don't change and those core financial habits and the principles that remain the same, and really helping people connect those dots. And I heard it said on that panel, and understanding how their emotions dictate their actions and the impact that that has and that financial stress can have on their work and personal life balance. And honestly, the feedback that we've received on that seminar alone has really been incredible.
all right. So do we have any questions from the room? There's Rodney.
Yes, first of all, fantastic panel. But Don, I have a question for you. You talked about the different services and benefits you're providing through your worker solutions, which I thought was fantastic. There I like the back. Oh, there we go. There's an organization called Ownership Works. You're shaking your head, so you're familiar, so you know where I'm probably going, where they are a big advocate of providing equity for all, broad-based equity. as a way to build financial wealth so that when those private companies have that liquidity event, everyone participates. Has that been something that you've explored for your portfolio companies?
So we actually have two companies in our portfolio that are ESOPs, right? That have employee stock ownership programs. And so private equity, which is the kind of the source of capital that is behind ownership works, obviously is a little bit different from private credit, right? So private equity has obviously much more control over the day-to-day operations, if you will, including the financial well-being benefits that they actually introduce. So they actually started at the end, have now come back to the beginning. So from my understanding, they recognize that the end is way too far away for a lot of low and moderate income folks, that they have daily cash flow and financial well-being issues that need to be addressed now. So they are now introducing financial coaching and, along with other services that are on our platform. And to your first question, so in terms of the financial well-being world, I think I mentioned credit building for renters. We do have at least one home ownership solution on our platform, a 0% small dollar loan piece, student loan retirement benefits, as well as tuition assistance, as well as emergency savings. And so that kind of gives you, those are really kind of the primary financial well-being services and solutions that we have on our platform.
So I think we only have a couple minutes left. Are there any other questions before we wrap up the panel? I didn't see any online.
A question for Dawn again about prevalence and commonality of private credit organizations taking this step to help their portfolio companies implement financial well-being programs. Would you say Lafayette is kind of a unicorn, or is this a growing trend?
We don't want to be a unicorn, actually. We want to have friends. And so I would say that we are, at the forefront of really delivering managerial assistance, measuring the impact of it as it relates to company performance, as well as productivity. But the idea is that private capital actually can be an amazing force for improving and enhancing employee benefits, particularly for low and moderate income folks. And so we would love more folks in private capital and private equity, quite honestly, get the joke, right? To understand, call it leaning into your power, to really lean in, that it's really a win-win, not just for the employees, the companies, but also for the fund itself.
All right, Megan, do you have any final words that you'd like to share with the group? Any takeaways?
The takeaway that's always most present for me is really getting people to understand that financial well-being is not a milestone, that it's a journey, and that it changes depending on where you are in your life. And getting that message across is something that we really strive to do.
And Barbara, I'll let you have the last word.
Well, thank you. What I would say is to employers, every employer has a financial wellness program. It may be starting with just a salary, but it's a salary. It's a financial benefit to people. And then just looking at what you have and when you can add more. And there are a lot of free or no cost services out there that you can employ. Check with the other benefit providers that you have. Like I said, we had that AHA discovery when we looked at our one program. And then just keep talking to employees, keep letting them know that there is support help them, connect them to the resources that are there. And then just, again, keep, trying, and we do have to change up all the time how we're talking to people, because
Mhm.
what makes sense to one person may not make sense to another. And it is all, also, I think timing can be everything, right? So keep talking, because you don't know when the time is right for somebody. So keep talking, reminding them that these benefits are there, and then how they can use them, and, keep connecting them to those resources.
Thank you.
Yeah.
everyone.